How does a biopsy diagnose lymph node TB? Diagnosing lymph node tuberculosis starts with a biopsy, which is a procedure to obtain a tissue sample from the lymph node. This sample is then examined in a lab to find the bacteria that cause tuberculosis, known as Mycobacterium tuberculosis, or to identify specific changes in the tissue that suggest an infection. There are two main types of biopsies used for this purpose. The first is a fine needle aspiration biopsy. This method uses a thin needle to draw out cells or fluid from the lymph node. It is a minimally invasive procedure, meaning it doesn't require major surgery, and it is often more affordable, making it useful in places with limited resources. The second type is an excisional biopsy. This involves surgically removing part or all of the lymph node. This approach is typically used when the results from the fine needle aspiration are unclear or when there is an abscess, which is a collection of pus that can complicate the diagnosis. Once the tissue sample is collected, several tests are performed to confirm the presence of tuberculosis. One important method is histopathological examination. In this process, the tissue is stained and looked at under a microscope. Doctors look for granulomas, which are clusters of immune cells that form in response to tuberculosis, and for caseous necrosis, which is a type of tissue death that has a cheese-like appearance and is typical in tuberculosis infections. Another method is acid-fast bacilli staining. This test uses special stains to identify the bacteria within the tissue. Finding these acid-fast bacilli can confirm the presence of Mycobacterium tuberculosis, but sometimes these bacteria are present in very low numbers, making them hard to detect. Microbiological culture is also performed, which is considered the gold standard for diagnosing tuberculosis. This involves growing the bacteria from the biopsy sample in a lab. However, it can take several weeks to get results, as the bacteria grow slowly. Molecular tests, such as polymerase chain reaction and the Xpert MTB assay, are also used. These tests can quickly detect the DNA of Mycobacterium tuberculosis, even when the amount of bacteria is low. They can also check for resistance to rifampicin, an important antibiotic used in tuberculosis treatment. In some cases, imaging techniques like ultrasound or computed tomography are used to guide the biopsy. This helps ensure that the sample is taken from the most affected areas of the lymph node, improving the chances of a successful diagnosis. The combination of these methods provides a thorough approach to diagnosing lymph node tuberculosis. This is particularly important because lymph node tuberculosis often has a low bacterial load, which can make it challenging to diagnose. A biopsy helps distinguish tuberculosis from other causes of swollen lymph nodes, such as lymphoma or bacterial infections. In summary, a biopsy is crucial for diagnosing lymph node tuberculosis. It provides tissue for detailed examination and laboratory tests, confirming the infection and helping doctors plan the right treatment. If you suspect you have tuberculosis or have symptoms, it is essential to consult a healthcare professional for proper evaluation and care.